smooth passage through the tissues. The friction is going to be less because the surface of the suture is smooth. Microbial harboring is going to be next to nil because there are no crevices, no interstices present, correct? What is the disadvantage? Special care, okay, while handling. More skillful handling is required. Because they're extremely smooth, they can just slip through the tissue. Then you also need multiple knots to secure them because again, they're very smooth. So multiple knots are required to secure them in place, okay? Coming to the next term, that is multi-filament sutures. So multi is many, filaments is threads, right? So there are multiple threads coming together in the constitution of this suture. So now these sutures, multiple threads come together and they are either twisted or they are braided forms. Twisted is just, they're just twisted over each other, or braided is like a proper ponytail, they're just braided together. As you can see in the schematic representation and microscopic representation of the sutures on your right side, okay? What is the advantage of the suture? The handling and the time characteristics are very easy. So if you're beginning with, in the initial parts of suturing, where you're just learning to suture, might as well go with a multi-filament suture rather than going with a monofilament suture. Because it is not very expert, a technique sensitive kind of suture that you can deal with, correct? Why? Because multiple threads are coming together, the surface of the suture is rough. Multiple knots are not required. Maybe in just 2 knots, the suture is going to be secured, correct? It will not slip through the tissues because it is not smooth surfaced. On the other hand, the disadvantages of the same would be, what would be the disadvantage? It has multiple crevices and interstices where, the bacteria can go and harbor and settle, right? That is one disadvantage. And second disadvantage would be, since the surface is rough, the passage becomes little, it offers or delivers some kind of friction when it is passing through the tissues. So the chances of fraying of these sutures is very, very common. Is this thing clear? So these concepts should be very clear. So again, I've included this diagram where a clear difference between monofilament and multifilament sutures is there. You can see the surface of the monofilament sutures, which is absolutely smooth, right? On the other hand, for multifilament sutures, be it braided or be it twisted, it is not smooth, okay? It has those crevices and interstices. I hope this point is clear. Now coming to the next classification, which was not included in the initial classifications is, the sutures can be divided into coated and non-coated ones. Now, this coated wala term came into picture when these multi-filament sutures offered great friction when they were passing through the tissues. So, mostly these multi-filament sutures are coated with a lubricant so that the passage through the tissues is little smoother, it is frictionless, okay? It is easy. Is this thing clear? So what kind of material is used? Obviously, a biologically inert material is used as a lubricant, and a thin layer of this lubricant is applied on the suture so that they very smoothly pass through the tissues without delivering any damage or friction. Is this thing clear? So you can always find the sutures that are coated with a lubricant would always be a little shinier than the non-coated ones. Okay, fine. Another way of classifying the sutures is based on their diameter and thickness. Okay. So now ranging from 10 to 10, we have different diameter sutures available. Okay. More the number of zeros, more thinner will be the suture. So thinner will be the suture that is used. So now in our maxillofacial casualties, we used to make use of 30 and 40 sutures more often. On the other hand, our ophthalmology counterparts, who required conjunctival suturing and thin tissue suturing or friable tissue suturing, they used to go with 50 and 60 sutures. Okay. On the other hand, our general surgery and orthopedic counterparts, who were dealing with more stiffer tissues and kind of more stiff tissues and thick tissues, they used to make use of 20 sutures, 0 sutures. Okay. Because they used to perform all scalp suturing and other limb suturings and all, correct? Okay. So now the various requisites for a suture material are, they should have good tensile strength. If I have to call it as an ideal suture material, the tensile strength should be good, right? Second is tissue biocompatible. The tissue reaction should be less, correct? Low capillarity. This point I will explain in the next slide because I want you to understand basics very well. The fourth property is good handling and knotting properties. Okay, a suture should have a good handling and knotting property. Less number of knots should be needed, right? So that you will save on to some time. Sterilization without property deterioration. Since sterilization in sutures is mandatory, the properties of the suture should not degrade on sterilization, right? Now coming to the point that I did not explain in the previous slide is capillarity of the sutures. Okay. Now as you can see, one schematic, beautiful representation is given on the left side of your slide. So what is being done? There are two glasses. Okay, one glass is empty and one glass is filled with a blue color tinged fluid. And there is one tissue paper which is twisted and it is folded. Okay. So what it is doing, can you see that the water is drawn along the length of this tissue paper? Right? This property a suture material also has. Okay. So now this suture material, what is the meaning of capillarity of the suture materials? That means if a suture material has high capillarity, means that suture material has a tendency, has more tendency of drawing fluid, tissue fluid along its length. Is this term clear? Now, what happens when a suture material has a tendency of drawing fluid towards its length? This tissue fluid is also going to have a lot of bacteria in it, right? And what happens when this, with high capillarity, the sutures tend to pull that fluid towards their length, and that is how they are inviting more bacteria in the wound site. So, do you think a high capillarity of the suture is a good point for sutures? It is not, obviously, right? Low capillarity, an ideal suture material should have. High capillarity means it is going to draw more fluid, and with the fluid will come the bacteria hand in hand. Okay, so we don't want bacterial incorporation into the wound sites. That is why capillarity of the suture material should be as low as possible for it to be called as an ideal suture material. Is this thing clear? Now, this suture can be divided into two parts, that is your suture needle and your suture thread. Okay. So, I will be first talking about different types of, different things regarding the suture needle, and then we'll be dealing with the suture materials. Okay. So, coming to the suture needle now, we have parts of the suture needle. Now, this is another point where I've seen undergrads being, maximally confused. Please understand this very, very well. Okay. So these are the different parts of the suture material. The one that is given here is the needle point. This is the point from where the needle enters into the tissue. Is this thing clear? Now, exactly opposite to this is where the suture material is attached. That is your suture attachment point. Now, if I have to join a line, a straight line joining these 2 points, that becomes my needle cord. And if I have to measure the length of that line joining these 2 points, that becomes my needle cord length. Okay. In between this needle point and the suture attachment point is my needle body. Okay. If I have to draw a line which is perpendicularly extending from the needle body and it is perpendicular to this needle cord length, that becomes that the length of that particular line becomes my needle radius. Okay. Now this particular, if I have to straighten this curved needle and if I measure the length of this needle, that becomes my needle length. Is this thing clear? If I have to cut this needle and measure the diameter of the cross section of the needle, that becomes my needle diameter. I hope this thing is very clear. So the next time, your professors are using these terms, you should be crystal clear with these terms, right? Now coming to different classifications of the suture needles. So the first classification is based on the eyed end of the needle. So there are certain needles which have this eye present and you have certain needles which do not have this eye present. The suture material is directly incorporated into the needle. So those needles are also called as non-eyed needles, or they are also called as swaged needles. Please understand this term, non-eyed or swaged. Okay. So mainly the packaged sutures that are available in this form, that is swaged form. On the other hand, the non-packaged ones, they are available as separate needles. Those are eyed ones, where you have to put the thread. You have a spool of thread present, correct? Especially the silk ones, that is very commonly academically available. So we have to cut those sutures and then we have to pass the suture through this eyed part. Now, what is the difference? Which one do you think is more traumatic? The swaged one or the eyed one? As you can see in the picture, the eyed one is little broader, right? Because it has to incorporate that thread. The thread has to be passed through that eye. Hence, it is little broader. This end is little broader. And hence, it is slightly more traumatic than the swaged needle. Okay. And also a little cheaper than the swaged needle. Okay. So that was about eyed and non-eyed. Now, coming to more technical classification of the suture needles. So based on the longitudinal shape, we have different types present. Now, The straight, half curve and compound curvature I'll be explaining in this particular slide. The rest of them I would be explaining in the next slide. Okay. So the straight one, can you see this particular straight one that is resembling a sewing needle? Isn't it similar to a sewing needle? So the question is it very commonly used? I would say not very commonly used. Not in max pack, nor in dentistry, nor in any other kind of surgical practice. Although it can be used and it has been used, and in certain places it is less commonly used in emergency cases, and also you can use them in more accessible cases, okay, broader areas, accessible cases like some skin laceration, or in oral surgery, or in dentistry, it can be used in anterior maxillary areas. Okay, it can be used, not very commonly used. Now, the next type of suture, that is this half curve. Why is this called half curve? Because as you can see in the first half of it, it is straight and then it blends into a curve, right? So that is half curve. It lies somewhere between a straight needle and a completely curved needle, right? So basically, is this very commonly used? Again, this is not very commonly used, but in certain emergency cases, where you don't have a needle holder also available, you can make use of these needles, the straight one also and the half curve also. And you can, the suturing can be performed. Again, it can only be performed in accessible areas, the skin areas, external areas. Intraorally, it is very difficult to use these kind of needles. Okay. Uh, Coming to the last one, that is the seventh one, that is compound curvature. So as you can see in the picture, the first of all, the name states compound curvature. What is the meaning of compound? Two or more, correct? So when you say it is compound, that means, and curvature, that means there are two or more curves incorporated in the needle. So as you can see here, in the beginning of the needle, it is blending, it is starting off in a very gentle curve, and then suddenly there is a sharp curvature that is there, okay, when it comes close to the needle point, okay, which means there are two or more curves which are incorporated in the needle configuration. So where is this commonly used? Again, it can be used in the structures which are, deep, inaccessible kind of structures. In intraoral cases, we can make use of these structures, in the deep palate cases. Okay. So these needles have been used. And now coming to the third, fourth, fifth, and the sixth type of needle, I'll be explaining in this representation now. Now this is a particular circle which is divided into 8 equal parts. Okay, see, I've also named it like 1, 2, 3, 4, 5, 6, 7, 8. Right? If I have to include, if a needle comprises of or includes two parts of this circle which is divided into 8 equal parts, okay, that becomes my 1/4 kind of a needle, because it's like 1/8 plus 1/8. That becomes my 2/8. 2/8 is 1/4, correct? So that is how it is 1/4 of a needle, this particular thing. So it will be very shallow kind of a needle, okay? Coming to 3/8 kind of a needle, if I involve three parts of this particular circle, which is divided into 8 equal parts, that becomes my 3/8, 3/8 kind of a needle, okay? If I have to involve four parts out of 8 parts, that is 4/8, that is 1/2, that is half. Half circle is involved, that becomes my half kind of a needle, or 1/2 type of a needle. If I involve 5 parts of these 8 parts, that becomes my 5/8 kind of a needle. I hope this thing is clear. Now coming to the interpretation of whatever we've just learned in the previous slides. So if the cord length is more, if I say the cord length is more, what do I mean? That the needle is bigger, okay? If the cord length is, if the needle radius is more, that means the curvature is more. See, if the needle radius is more, that means it is more curved, right? If the needle length is more, what do I mean? It is a longer needle. If the needle length is more, it is a longer needle. If the needle diameter is more, what do I mean? Common sense, right? It is a thicker needle, okay? Right. Now coming to the execution part of it. Okay, all the technicalities have been understood. Now where do I use it, madam? So in the areas which are restricted, which have inadequate space, we'll make use of a smaller needle which has a small needle length, correct? In the places where the area is adequate, adequate space is available. So in those cases, you can make use of longer needles. You can make use of needles which have more needle length, correct? In the superficial tissues, we can make use of needles which are less curved. That means which have less needle radius. In the deeper tissues, on the other hand, inaccessible ones, deeper, you have, kind of a curved palate, a deep palate in which you have to do suturing, maybe for a cleft palate or something. You can go with a more curved needle. That means which has more needle radius. More curvature of the needle, more is the radius of the needle. Correct? As you can see here in blue. Is this thing clear? Okay. Now coming to another technical classification, which I've seen students getting confused a lot. So these are the points available on the suture packets. Okay, so how do you read this? So when you have the circular kind of a thing available, then it can either be a taper point needle or it can be a blunt taper point needle. Okay. So what do I mean by taper point needle? Taper point means, as the name suggests, taper, it is tapering from the suture attachment point to the needle point progressively, and this particular end, that is the needle point, is sharp. Okay. On the other hand, when I say blunt taper point needle, yes, it is progressively tapering from the suture attachment point to the needle point, although the tip of the suture is going to be, or the point of the suture is going to be blunt. Okay, needle point is blunt. Is this thing clear? Now coming to the next type, that is your taper cut needle. Now what is the speciality of this needle? As you can see here, the cross section to begin with is circular, it is round. Okay? But at the end, when you come close to the needle point, it becomes sharp. It develops, or it has a cutting edge as it comes closer. Okay. So what happens? This particular cutting edge helps in penetration of the needle through the tissues, but then the entire body then does not have the cutting edge. Okay, so that makes it atraumatic. Correct. Now coming to these two kind of needles. Now these are exactly opposite, as you can see. This is one triangle, a straight triangle, and this is an inverted triangle. So what do I mean by a needle as a cutting edge needle? So as you can see here in the cross section, it is a straight triangle. Now here, the cutting edge is present on the inner side of the suture needle. That means it is present on the concavity of the suture needle. Now, what is the disadvantage of this? A disadvantage, or I would say a property of this needle, that it is very, very sharp. So you can only use this kind of a needle in the tissues which are very stiff, very tenacious. You can't use them in friable thin tissues because this needle will just cut and tear off that particular tissue. Correct? Uh, Coming to the next one, which is exactly opposite of this cutting needle, that is reverse cutting needle, which is represented as a reverse triangle, ulta triangle. Okay. So now this particular needle has a cutting edge which is present on the convexity of the needle. It is not present on the inner side. Okay. So inner side is flattened, right? So you have cutting edges at the sides, and one more cutting edge is present on the outer side on the convexity of the needle. Okay, so now you can use this reverse cutting needle in less preferred tissues as comparison to the cutting needle. It will not cut through the tissues as much as a cutting needle would do. Okay. Now coming to another very interesting type of a needle, which is called as micropoint spatula needle. As you can see here, there is a beautiful, pointed tip, and you have a little cutting kind of an edge that is present in the needle to begin with. But although if you see the needle, it is flattened. It is not circular. It is flattened like a spatula. It is flat. Okay. So now, particularly, this particular needle is mainly used in, microsurgical procedure cases. Certain specialized in, they can be used in plastic surgery. Even ophthalmologists very commonly use this kind of needle, and it is available with catgut and even micro suture. Now coming to the different types of suture materials. So we are done with the suture needle classification. Okay. Now coming to types of suture materials. I will quickly go with different types of suture materials. To start with, I am starting with the surgical gut. Okay. Surgical gut was also called, it was derived earlier from the serosa of the cat. Okay, so that is also called interchangeably as catgut. Okay, although the right term is surgical gut. So it is an absorbable suture material. Okay, and it is obtained from the submucosa of the sheep intestine, and these days it is also available from the serosa of the bovine intestines. Okay, so one thing is clear that it is naturally derived. Okay, it is absorbable, so it will be broken down on its own. And this particular suture is broken down by enzymatic action and not by the hydrolysis process. Okay. Okay. So it is naturally derived from the human tissue, from the animal tissues. It knots well. It has very good knotting properties. Another very important thing is, since it is naturally derived, the chances of tissue reaction are more. Any suture which is naturally derived will have chances of foreign body reaction. The chances of foreign body reaction, inflammatory reaction, would be more than the synthetically obtained sutures. Okay? Another thing is there that these sutures, they become brittle if they are dry. So one thing you have to remember that the surgical gut suture is always available. The packet of the suture is always available with a fluid. It is always available with a fluid so that it doesn't dry out. If it dries out, it will become brittle. It will not be soft and pliable that it is. Okay? And it cannot be used for long-term uses because, as you can see here, there are two types of these of surgical gut. You have a plain gut surgical gut suture, and we have a chromic surgical gut suture. Okay, so the plain one, it is absorbed in 7 to 10 days. Okay, and it is used for extremely rapidly healing tissues. 7 to 8 days, it cannot last more than that. And what happens with this particular plain gut suture? The chances of foreign body reaction were even more. So that is why we came with this chromic gut suture. As the name suggests, chromic means it is derived from the term. There are chromium salts incorporated onto the surface of the suture. Now, what is the advantage of adding these chromium salts? These chromium salts made the suture material less reactive, less foreign body reactions were there because of added chromium salts. And one more advantage of this was it became a long-lasting suture. The suture life increased. So in plain catgut suture, it is resolved within 7 to 10 days. On the contrary, the chromic catgut suture, it resolves in about 10 to 21 days. Okay? So it's like almost double or almost twice the duration of plain catgut. So that is the advantage of chromium catgut sutures. Okay, both the sutures, plain and chromic, are available with the incorporated liquid in the suture packets. So if you come across a suture packet which has liquid in it, it is 100% going to be a surgical gut suture. Okay. So these are the different packets. Although I couldn't procure the image where the liquid is shown from the net. Advantages are what? It is biodegradable, right? Because it is absorbable, right? It is flexible and it is very easy to handle. Aesthetic suturing is possible, right? So it is also used in most of the cleft surgeries and all. Okay? Disadvantages are it can cause significant tissue reaction. Yeah, it is notorious for causing tissue reactions. It is less predictable absorption, okay, because the absorption is little a problem. The duration of absorption sometimes it can just resolve a little earlier than expected. Not ideal for critical support structures, but obvious, right? You can't be using them in cardiovascular and orthopedic surgeries and all some critical structures, right? Because the absorption is not 100% guaranteed. Right? Okay, so where it is used in closure of extraction sockets, very commonly used in in some parts of America and all Los Angeles, and very commonly used for closure of extraction sockets. Okay, it is used for suturing gingiva, mucosal tissues, in alveoloplasty cases. It is used for soft tissue repair, and as I mentioned, for cleft surgeries, because beautiful aesthetic suturing is offered by these catgut sutures. Okay, right. Although one problem is there with these sutures, that intraorally now sometimes the suture ends can be little pokey. They can be a little irritating and a little pokey at times. So that becomes a little problem, which is not mentioned here. Coming to the next suture, that is vicryl suture, the scientific term of the same is polyglaptin. Okay, remember. So it is a synthetic, absorbable, and a braided suture material, which means it is multi-filament suture material, correct? So it is absorbable, so it resolves in around 56 to 70 days, that is around 2 months. So there is vicryl rapid variant also of the suture available, which resolves in around 2 weeks, about 14 days. Okay. Now in multi-filament suture, since it is multi-filament, it is going to have excellent handling properties, knotting properties going to be good, right? As I mentioned in the earlier slides. Most of the times it is also available with the coating because it is multi-filament and suppose the surface of the suture is supposed to be a little rough. It is available with this coating also these days. So that is called as vicryl coated type of sutures. Absorption is predictable. It is not as unpredictable as surgical gut. So that is a good thing. And the tissue reaction is minimal. It is minimal because it is synthetically derived. Okay, minimal or it is next to nil, okay, because it is synthetically derived. Now the advantages are same. There is no need for suture removal because the suture is going to resolve on its own. The general advantage of a absorbable suture: predictable healing, strong and secure knots can be established, less tissue reaction. Okay, coated variants, they glide smoothly. Disadvantages would be since it is a braided, so general disadvantage of any multi-filament suture, bacterial harboring is more, correct? And now generally it is more expensive than catgut and the silk sutures. Okay, and it is not as smooth as monocryl. So monocryl is my next suture that I would be describing. First, I'll complete the uses of vicryl. Vicryl suture is very, very commonly used in oral surgery, periodontal surgery, for implant surgery cases, For bone grafting cases, okay, in and out, we use these sutures. And in oral maxillofacial casualties, we used to use them for subcuticular suturing, for submucosal, intraoral suturing. We do not use them for extraoral suturing very commonly. Okay. So for palatal and cleft surgeries, okay. Then in pediatric dentistry, we make use of vicryl rapid. Okay. Now coming to the next suture, that is monocryl, that is polyglacapryl, the scientific name of this monocryl. So it is a synthetic monofilament absorbable suture that is available. Absorbable. So how many days does it? So if I talk about absorbable sutures, you should have a tentative idea around how much duration it takes for it to absorb, right? So monocryl absorbs in about 3 to 4 months, and by the process of hydrolysis. It is monofilament. That means it is going to be very smooth. Okay, the passage is going to be very smooth. Yeah? The tensile strength is very good for a monocryl suture. Tissue reaction is minimal because it is synthetically obtained, and it is soft and pliable also. Advantages are smooth tissue passage, bacterial adherence is less because it is monofilament. Predictable absorption, yeah, it is much predictable because it is much predictable. See, when the suture material gets absorbed by hydrolysis process, the absorption of the suture material is more predictable. When it is by enzymatic action, like your surgical cadman, it is little unpredictable. Okay. Okay. So it is soft and flexible. Okay. There is no need of suture removal because it is an absorbable suture. Disadvantage is what the tensile strength is not as good as vicryl or PDS, those those sutures. And also it is little more expensive than catgut and silk. Okay. And it is not ideal for bone grafting or very high tension closures. So you'll never make use of these sutures for very high tension areas. Okay, because they are not the kind of tensile strength that they have is not as much as vicryl sutures and all. So that is why it is not used for very high tension cases. Uses are periodontal surgery, oral soft tissue closures, okay, implant surgery, cosmetic and aesthetic dentistry, pediatric dentistry. They can be used. Now coming to the next suture, that is PDS. The scientific name of it is polydioxanil. Okay. It is again a synthetic suture. It is monofilament and it is an absorbable variant of sutures, right? So absorbable, again I said. So what is the duration of absorption? So it takes approximately 6 months. Can you imagine for 6 months the suture stays in place? Okay, so it is the highest duration of the absorbable sutures. It is in the absorbable sutures, right? Often. Coming to its filament configuration, so it is monofilament. So bacterial colonization is nil. High tensile strength, very, very good tensile strength these PDS sutures have. Okay, the tissue reaction is minimal because synthetically again obtained, and the absorption is going to be slow. Advantages: long-lasting tensile strength, monofilament structure, smooth tissue passage because again it is monofilament, predictable absorption, right? Because it is absorbing by the hydrolysis process, as I mentioned in the beginning of this description of the sutures. Less inflammatory response because it is synthetically derived, right? Now the disadvantages are what? It is stiff, it is less flexible than the braided sutures. Okay, it is more expensive than vicryl and catgut, and the absorption is slow. So for the oral mucosa and cases where you need faster absorption, you don't have to make use of these sutures, right? Uses are implant surgery, periodontal surgery, maxillofacial trauma cases, palatal and cleft surgeries, orthognathic surgery cases. Okay. Now coming to our very commonly used suture, that is silk. Now what is the silk? Silk is a non-absorbable kind of suture. It is a multi-filament suture and it is naturally derived. Right? So particularly it is a natural fiber which is derived from the silkworms. And often this suture, since it is a multi-filament suture and the surface is going to be a little rough, it is often coated with wax or silicone, a rubber-like coating. Okay? Now, this particular suture material, as you can see here, either available in spool form, okay, or it is available in as a packaged suture, okay. So absorption, it is non-absorbable suture, okay. Although we say it is non-absorbable, but it degrades, it degrades over a period of time. Almost within a year, it completely degrades, okay. Tensile strength of the suture is very high. Although it weakens sometimes, it may just be little, it may weaken if there is some enzymatic degradation that happens. But I would say like more or less the tensile strength is very good and very commonly used kind of suture. Knotting property is excellent. You don't have to tie like 3-4 knots. In 2 knots itself, or just max to max 3 knots, it will be like completely secured. Correct? Not opening will never happen in these sutures. So coming to tissue reaction, moderate tissue reaction is possible because it is naturally derived one. So advantages, excellent handling and knotting properties it has. The flexibility is good, and very beautiful advantage of this is since it is black in color, okay, it offers great contrast to the oral tissues. Means it can be easily appreciated in between the pink oral tissues, correct? So it is very easy for suture removal because it will be like standing out bright black in contrast to the pink oral tissues, right? Or red oral tissues. Now, disadvantage is what? The increased tissue reaction chances, right? Bacterial wicking, that is, the capillarity of the sutures is high. That is the disadvantage of the suture. So, the capacity of a suture to draw fluid along its length is highest in silk sutures. Remember. Okay? Then they are non-absorbable, so typically they require a follow-up visit. They cannot be, they don't usually resolve on their own. Even if they do, they take around a year or something. So before that, they need removal. The second visit is required. Very commonly used in oral cavity, for periodontal surgeries, for tooth extractions, for implant surgery, soft tissue grafting, and oral and maxillofacial surgery also. Very, very commonly used, correct? As you can see here, can you very easily appreciate the suture intraorally? That is because of its beautiful black color, correct? Okay, now coming to the next suture, that is polyester suture, that is also called as ethibond suture. So it is a non-absorbable synthetic multifilament suture, okay? So the material is what? It is a synthetic polyester, as the name states, right? It is non-absorbable and it is usually available in braided form. And usually it is, since it is a multifilament suture, it is also coated with silicone or Teflon coating. PTFE is nothing but Teflon coating. Okay? The tensile strength is extremely high, very, very high. Okay? Knotting properties is also excellent and tissue reaction is minimal because again, synthetically obtained. So advantages are what? High tensile strength, minimal tissue reaction, very good knotting properties, resistant to degradation. Okay. Disadvantages are multi-filament structure can promote bacterial adherence. That is a common disadvantage for all the multi-filament sutures. The one specific disadvantage is it is less flexible than silk. It is much stiff as comparison to silk. And it can cause discomfort if it is left in place, if it is not removed, because it is very, very stiff kind of a suture. Is it very commonly used in oral surgeries or in dentistry? No, not very commonly used in oral surgery or in dentistry. Okay, it is used in general surgeries and cardiovascular surgeries, ophthalmic surgery. It is used in orthopedic surgery, but not very commonly used in oral and maxillofacial surgery or dentistry in general. Okay, coming to the next kind of suture, which is a Teflon or PTFE kind of a suture. So it is a synthetic non-absorbable monofilament suture. So basically, the properties of these sutures are it is biocompatible. Okay, it is soft and flexible, very flexible and soft tissue. The wicking nature of this particular suture is less. That is capillarity is very, very low, so it is very ideal. The tensile strength is very high for the sutures. Handling and knotting properties is very, very good. The tissue reaction is minimal and it is very smooth surfaced. So passage without friction is very easy. Now coming to the advantages, the same advantages are there. Now coming to the disadvantages, Teflon sutures are not very easily available and also they are very, very expensive. Okay. So are they very commonly used? Not very commonly, although they can be used in periodontal surgeries. We use them in even dental implantology cases. In oral and maxillofacial surgeries also, they are very commonly used. Not very commonly used, although they can be used. Okay, they are very ideal properties they have, although not very commonly available, hence not very commonly used. Okay. Now coming to the steel wire, as you can see here, these are steel wires with incorporated needles. Okay. So basically, these are obviously non-absorbable ones, and they're synthetic sutures. They're derived out of stainless steel. The tensile strength goes without saying, right? It's going to be extremely high because it's steel after all. Okay? Absorbability, they are non-absorbable. They do not degrade in the body, right? So they are going to stay forever, right? Knot security is good, although it becomes a little difficult to tie knots for these sutures. Okay, but once secured, the knot security is going to be good. They will never come out, right? Okay, so the radio opaque, these are the only sutures which are radio opaque. Okay, advantages: high tensile strength, resistance to infection. Disadvantages are what? Patient discomfort, right? Wire breakage chances are more. They are more difficult to handle due to rigidity and they may require removal if irritation or complications occur, right? Coming to the uses, are they used in oral max pack? Make use of arch wires, okay? But we don't have these suture materials as incorporated needles. For intermaxillary fixation, in our cases for arch bar fixation and all, we make use of wires, okay? I haven't come across the suture in which, you have incorporated suture needle with these wires, okay? But they are very commonly used for cardiovascular surgeries and open heart surgery, where the sternum needs to be, osteotomy is performed on the sternum, and then to suture that sternum back, to close it back, we have to make use of these kind of sutures. Okay. So for fracture fixation, orthopedic procedures and all, again, they are used very commonly for tendon repair, for ligament repair. Also, they are used. Okay, but not very commonly used in oral max pack. We make use of wires and all, right? But not the ones with incorporated needles. Coming to the next suture, that is nylon or ethylon. Okay. Now, this nylon or ethylon sutures we used to very commonly use for extraoral suturing. Okay, extraoral suturing, very commonly used suture in casualties. Okay. Okay, having said that, it is a synthetic suture, it is non-absorbable, and it is either a monofilament or it is also available in multifilament form. Okay, it is non-absorbable, so it degrades very slowly. Slowly it degrades, but it is going to remain in the body for a longer time if it is not removed. The tissue reaction is minimal, it is next to nil. The tensile strength is very, very good.
Excuse me, ma'am. Sorry
Yes.
to interrupt you.
Yes.
There is a request to all the participants. Please do not draw on the screen. This is a humble request to all the participants. It is very disturbing. Okay, ma'am, you can continue. Sorry for the interruption.
Yeah, no problem. Yeah, so I was talking about good elasticity. So these are the only sutures, which kind of stretch. Okay, when if you just pull the suture now, you will see that there's been some amount of stretching that happens in the suture. So what happens? It can stretch slightly to accommodate the swelling and all also. That can happen, post surgery or post some laceration that has happened. Swelling is going to happen, right? So what happens? These sutures will not break. They will, if some margin of expansion is present in the sutures, therefore they offer some margin of expansion for the tissues also. Okay. So knot security is not that great. So you have to tie like multiple knots, because especially if it is a monofilament suture, knot security, you have to tie multiple knots to secure it in place, right? Advantages: good strength, good elasticity. The tissue reaction is minimal. The disadvantages, on the other hand, are it can be difficult to handle due to its memory effects. Another thing is there. So if you tie it in a specific way and if you have to untie it, it will never go into its original form. It will always have that specific memory. Okay. So I don't think it is a major disadvantage, but yeah, fine. So if you kind of kink it, or before suturing, if you kind of kink it in any ways, it will remain in a kink form, in a bend form, right? So that is one disadvantage of the suture. Another thing is, because it is very smooth, you have to tie like multiple knots to secure it in place. Otherwise, the knots will open. Okay. So where it is used for skin closure, for external wounds, laceration cases. As I mentioned in the beginning, used to very commonly use them in the extraoral suturing in our casualties, right? So general soft tissue approximation for microvascular neurosurgical, we make use of these sutures, and for retention sutures in case of high tension wounds, because they incorporate some amount of, they have some amount of stretching. Therefore, they can incorporate some amount of swelling. So they can be used in retention sutures also. Coming to the next suture, that is our proline suture, which is also called as polypropylene. That is the exact scientific name of it. So it is a synthetic, non-absorbable and monofilament suture again. Okay. Coming to the properties, it is made up of polypropylene, hence it is called as polypropylene suture, proline suture. Absorbability, it is non-absorbable. It is monofilament, and therefore it is smooth. The tissue drag is going to be minimal. Tensile strength is high. Reaction is minimal. It is inert, biologically inert. Okay. The color is typically blue, but sometimes it is typically blue only, most of the times. But nowadays, a clear variant of it is also available. That is a translucent kind of a suture is also available these days. Advantage of the suture is minimal tissue reaction. Again, high tensile strength. It is monofilament, so the surface is going to be smooth. Excellent biocompatibility. It is non-absorbable. It is flexible and pliable, and it is radiolucent. It doesn't interfere with the X-rays. Okay. Disadvantages are, it is the surface of the suture is slippery. Okay. because it is monofilament. Knot security is again an issue because again a general disadvantage of monofilament suture. It is non-absorbable, right? So the patient has to come for the removal of the suture. Suture extrusion is a risk that is involved, and the cost of the sutures is also very high. Okay, it is an expensive suture. Uses are, it is used for skin closure, for CVS cases, ophthalmic cases, hernia repair, and general soft tissue approximation. Okay, so now another very important part that I want you all to understand: how to read. Now we are done with suture needle part. We've done with the various suture materials. Now we come to, since we are aware of both these things now, I want you all to understand how to read a suture packet. Okay, so you will have specifications which are related to a suture needle, and we'll have specifications which are related to a suture thread. Okay, so related to suture needle here on this particular packet that is shown on the screen, we have certain specifications given. Like the first one is 3/8 kind of a needle. So when I say, okay, 3/8 kind of a needle, okay, so that diagram that I just showed you all, a circle which is divided into 8 equal parts and 3 parts, are forming 3 parts of that particular circumference of that circle, is this particular 3/8 circle needle. That means it is a very shallow kind of a needle, correct? Second specification was that needle length is about 16 millimeters, that is about 1.6 centimeter, correct? It is a cutting kind of a needle because it has this straight triangle that is involved. So that one thing should come in your mind, okay, it can be only used in stiffer tissues, very, very stiff tissues. I can't use them in friable and weak tissues. Otherwise, the suture will just will just tear through the tissue. Okay. So this is how your process of thinking begins. When you read the specification, this is how you should start thinking, by reading the specifications. Okay, where the suture can be used. Just merely reading the specifications, you should know the execution of the suture. Okay. So coming to the suture thread, it is silk braided. Okay, that is what you can see. It is rightly mentioned here. It is a silk and braided kind of a suture. Then we have 3/0 kind of a suture. Okay, non-absorbable suture, which is obviously it is a silk suture, so it has to be non-absorbable. Now there is one term that I'm sure most of them would not be available, would not be knowing this term. So that is 2 metric. Can you see here that it is mentioned? It is 2 metric. What is the meaning of 2 metric? So it is nothing but the diameter of the suture thread. I'm not saying suture needle. I'm saying diameter of the suture thread. So when I say it is 2 metric, it means it is 0.5 millimeters. So when I say metric is what? It is the diameter of the suture. So 1 metric is 0.4 millimeters, 2 metric is 0.5 millimeters, and so on. Okay. So more metric, more is going to be the diameter. Remember this. Now coming to next important part, the various principles of suturing. Very, very important. Okay. So I would have to kind of go a little fast with this because detailed explanation of it is not under the purview of this seminar here. Although I would try to describe it a little bit. Um, Needle grasping, where it should be held when you are doing the suturing. The needle should be grasped 1/3 distance from the eye and 2/3 from the point. Never should it be very close to the needle point, okay? Because that will make the penetration into the tissues and all difficult. The needle should always enter perpendicular to the tissue surface. It should always be perpendicular. It should never be what do you say? It will never be kind of parallel or something. It will always be perpendicular, so the penetration is better. Needle should pass along its curve. It should always pass along its curve. You should never try to push the needle just by curved needle. You should always try to, your dexterity of your hand should be such that the needle should pass along the curve, along its curvature, right? Suture should pass at equal depth and distance from the incision point on both the sides. So that is explained in the next. One sec, I'll just show that slide first. Okay. So this X kind of a distance. Can you see this? The distance from the incision, and also it should be equal from both the sides. It can't be like from one end it is like 2 millimeters, from the other end it is 3 mm. That should not happen. Correct. Another thing is needle passes from movable to the fixed tissues always, because movable tissue can move, as the name suggests, to the fixed tissue. Fixed tissue can't move from one end to another, correct? That is why it should always be from the movable to the fixed tissue. If you try to move this fixed tissue to the movable tissue, what will happen? The fixed tissue will tear, correct? Okay. So needle should always pass from a thinner tissue to a thicker tissue, the same ideology. So if the thinner tissue is little, kind of pliable, it can stretch a little bit, so you can extended from thinner to the thicker tissue. So on the other hand, the thicker tissue has more chances of not getting pulled, right? Now the needle should pass from deeper tissues. Always you should perform anatomical suturing, anatomical structures from the deeper layer to the superficial layers. Tissue should not be closed under tension, but obvious. Otherwise, what will happen? The blood supply will be compromised, right? And there will be dehiscence, there will be some gaping, all of those things will happen if a lot of tension is offered, right? Sometimes tissue necrosis can happen, okay, because of lack of blood supply. Tissue should not approximate, suture should not approximate the tissues and it should not blanch when it is being approximated. Why? It is blanching means there is less blood supply, correct? And less blood supply means over a period of time, it can either get necrosed and there will be gaping and there will be dehiscence, all of those problems will happen, correct? The knot should never lie on the incision line. I have seen most of the students, they tie a knot and the knot always lies on the incision line. That should not happen because if the knot lies on the incision line, what will happen? It will interfere with the epithelialization of the wound that is happening, right? And that will act as an interference. And then in that area, the suture can remain gaped, correct? So that should not happen. And the time of removal for the suture is always, for extraoral sutures is almost like 5 days. But for intraoral sutures, because it requires a little time for healing, it is around 7 days. Okay. So now here in the schematic pictures, whatever points I explained in the principles of suturing have been explained. Okay. Now, very quickly, I would be describing the armamentarium. So we have in suturing, we have a needle holder, we have a tissue holding forceps, we have toothed and non-toothed forceps. Under tissue holding forceps, we have two types, toothed and non-toothed, and we obviously have a suture cutting scissor. Okay. So this is a needle holder. So in the needle holder, we have this particular, these are the various parts of needle holder. So we have jaws, we have a joint that is present, we have a shank, then we have a ring in which we put our fingers, right? And we have a ratchet that is available. So we have 3 ratchets available. So the first ratchet is for light grasping. Okay. So use light light ratchet, or the first ratchet will be used when you're using a very thin needle. You know, if you use a second or third ratchet for a very thin needle, it will bend, right? Merely holding it will bend the needle, right? So second grip, that is middle grip. It is also called as medium grip or medium grasp. It is used for little thicker needles, you know, little thick needles. And for even thicker needles and for moderate tissues, which are not very stiff and not very friable. The third ratchet will be used for thicker needles and where you need suturing of very, you know, thick, stiff tissues, correct? Now coming to tissue holding forceps, so we have 2 types of tissue holding forceps, toothed and non-toothed. So for thick and stiffer tissues, we make use of obviously toothed ones. Okay, so it becomes easy for us to grasp. On the other hand, for very thin, friable tissues, non-keratinized oral mucosa and all of those things, we'll make use of non-toothed ones because we don't want that area to be damaged because of that tissue to be damaged because of our toothed forceps. Okay, I hope it is clear. Now, coming to surgical sutures now, I would not, I can't go into the depths of it. It is little not under the purview of this particular seminar. But you can just see that the different parts, like you have the cutting edge, then you have a hinge, then you have a shank, and you have ring handles. Very similar to the needle holders. Okay, and there are different varieties of scissors which are available, you know, addressing different needs. Okay. Then there is this Castro-Veio kind of needle holder and scissors also available for handling delicate tissues, very commonly used by ophthalmologists and plastic surgeons and all. Okay? Very, very thin and delicate needle holder and very thin, delicate scissors these are. And it is called as Castro-Veio. Veio. It's not called Castro-Vejo. Okay, it's the J is silent. Okay. Now, quickly coming to the suturing techniques now, I would be addressing each. Okay. So first starting with simple interrupted suture. As you can see in the picture, these are interrupted ones. These are individual sutures, different sutures. Each suture has its own knot, right? So very, very commonly used a suture. So it is a simple interrupted suture is one of the most common suture techniques that are available for wound closure. It is a very basic and versatile suture that is available. Advantages are the tensile strength is good, the wound approximation is good, and the most important advantage is if one suture fails, the other sutures are intact. So we need not have to worry, right? Disadvantage is what? it is time consuming, because for every suture you're putting a knot, for every suture, only then you can proceed with the second suture. You're cutting it, then going to the next one. So that can be time consuming. Also, more suture material is used in comparison to a continuous suture because you're tying knots, right, for each and every suture. Now coming to simple continuous suture, in which what happens? A simple continuous suture is a suturing technique in wound closure and is specifically used for long straight incision. So what is it basically? How to describe the suture? So the series of uninterrupted stitches are used, where the suture needle thread is passed in and out in a continuous manner, okay, without cutting each stitch. Correct? So it is very quick and efficient for for long wounds. Good wound approximation is done, and less suture material is used because you are not putting multiple knots. Remember this. What are the disadvantages? If one part of the suture fails, the entire suture is going for a toss. Entire suture will open up, right? So that is the major disadvantage. Okay. Less precise tension control. So sometimes what happens? In interrupted sutures, the control that is offered in the suturing is much more. In continuous, what happens? Sometimes little puckering, little uneven wound approximation can happen. Okay, you will understand that, or you will know that once you start practicing these sutures. Okay. Coming to the next variant of this simple continuous suture is continuous locking suture. So what is this continuous locking suture? It is also very commonly called as blanket stitch. Okay. So it is a variation of continuous suture, right? And what we do is that each loop is locked by passing the needle through the previous stitch. That is why it is called as locking suture, continuous locking. So it is similar to locking suture, although the loop is locked by passing the needle through each loop, right? So that is how it provides extra security, and it helps in even distribution of the tension, okay, throughout the wound. So it advantages what it is stronger than the simple continuous suture. The tension is very evenly distributed. The risk of dehiscence is less as compared to simple continuous suture. Okay? Disadvantages, what it can cause little puckering if the skin is too tight. Little puckering chances are more. It is very difficult to remove these sutures because you have, these particular sutures are more technically, more technical suturing is done. From one loop, the suture is passed, and because of those things, when you try to remove these sutures, it becomes a little difficult. There are chances that little bit suture material might be left behind. Okay? So now coming to the mattress sutures. So under that you have a horizontal mattress suture and a horizontal mattress suture and vertical mattress suture. Okay. So coming to, you have to understand this first, that whenever you talk about vertical mattress suture, the sutures will always be perpendicular to the incision line, vertical mattress. On the other hand, when you talk about horizontal mattress sutures, these sutures, they will always be parallel to the incision line. Okay. So coming to the vertical mattress and the horizontal mattress individually. So first of all, mattress suture is a type of surgical suture technique which is used to close wounds and provide strong wound edge margins. So in vertical mattress suture, what happens? It provides excellent wound edge eversion, and it is specifically used. The point to notice, it is used for a deeper tissues and in the tissues which are, which are under a lot of tension, right? So what you do is you insert the needle farther away from the wound edge, and then it is brought back to the close to the incision line. Okay. So now it is very difficult to explain the technique when merely describing it. You have to, see the videos, or you have to do some hands-on, you have to attend some hands-on sessions to understand the techniques. So what I'm emphasizing on is to make you all understand the different types of suture techniques that are available and what are the specialities or where they are used commonly. Okay. Horizontal mattress sutures, on the other hand, not used in deeper tissues and all, but they're used in friable tissues or wounds, again, which are under significant tension, right? So as you can see in the sutures, in horizontal sutures, a wide span is covered. So what you do is you pass a suture material from one end, you remove it from the other end, then pass from the same end, you remove it from the other end, and then you tie a knot on one side, correct? So that was about mattress sutures. Now coming to figure of eight suture. A figure of eight suture has its own set of indications. Why, first of all, it is called figure of eight? That is because when it is tied, right, it resembles a eight figure. It resembles eight figure. That is why it is called as figure of eight. The various advantages are it is used for hemostasis. See how here a vessel is kind of grasped and it is sutured. So it is used for hemostasis purpose. So in our casualties, whenever we used to come across vessels which used to bleed badly, and we used to perform this figure of 8 suturing. Okay. For tendon repair, it is also used for wound closure. It is used as bone anchor sutures. Okay. It is also used for closing our extraction sockets. Okay. Now coming to the next suturing technique, that is subcuticular sutures. So under this we have like interrupted and continuous. As the name suggests, subcuticular. Sub means under. Cuticle means cover or skin. So it is basically, this particular suture will never be seen on the skin surface. Okay, it will always be beneath the skin. That means it is never on the epidermal layer, but it is in the dermal layer. Suturing is performed in the subcutaneous or in the tissue, right? So that is why it is in the dermal layer. So why is this, why is this particular suture technique developed? So basically, a subcuticular suture is a technique which is used in surgery to close the wounds with minimal scarring. Okay, so in the aesthetic areas, we would always want to go with these subcuticular sutures because the suture is not used on the skin. The scarring is not, just the wound edges are getting approximated because the suturing is performed in the subcutaneous tissue and the wound edges get approximated, right? So the healing is good. There won't be any scarring because the suture is not passed through the epidermal layer. Okay, so it involves placing the suture in the dermis in a continuous buried fashion. So what are the key benefits of these sutures? So aesthetic benefit, right? The tension is going to be less over the sutures. The infection risk is minimal, is not there because it is not exposed only to the outer environment. Uses are cosmetic surgeries, facial wounds, pediatric surgery, orthopedic and general surgery, but specifically cosmetic and facial wounds, and also pediatric surgeries, right? You don't want a child to end up with a huge scar, right? Which would like lifetime for the child. Now coming to the sling sutures, again, these are very commonly used in periodontal surgeries, very, very commonly used in periodontal surgeries. Okay, so there are different types of sling sutures, like we have interrupted sling suture, we have a double sling suture, and continuous sling suture. Again, the exact techniques, how this suturing is done is not under the purview of this particular seminar. It's very difficult to explain the technique without showing anything, without showing any video or something. Okay, so coming to the applications of the sling sutures directly, we have, they're used very commonly for periodontal surgeries, they're used for implantology cases, ophthalmic surgeries, and also in general surgery. But related to dentistry, they're used in periodontal surgeries and implantology cases. In oral surgery, we use them in implants very commonly. Now coming to the knots. So there are two very important types of knots, that is either square knot or we have a surgeon's knot which is available. Surgeon's knot is very, very commonly used, which involves like, through two clockwise turns through clockwise throws, and then you tie this particular knot. To secure this knot, then we have something called a safety knot, which is tied, which will have a throw in the anti-clockwise direction, and then it is tied. Okay. So that was about the different types of knots. Now we are heading towards the end of the session now. So coming to that, we have learned about different types of suture materials and different types of suture needles and different types of sutures in general which are available. Now coming to certain devices or certain mechanical devices which are available apart from sutures for closing or for closure of the wounds or closure of the lacerations or incisions are ligating clips, then we have the surgical staples, and we have some tissue adhesives. Now, what are these ligating clips? Ligating clips are basically, exactly I would say, is used for stopping the bleeding from particular, vessel that is bleeding. So, for anastomosis, for vessel ligation, we make use of these ligating clips other than using sutures for ligation. Surgical staples are used for fast closure of the wounds. They are similar to staples, the staples that we use for stapling tapers and all, right? So they're similar to that. And tissue adhesives are also these days available. So it is it is specifically available in tube forms, or it is available in these bottle-like forms in which we can stick the tissues together with the help of these adhesives, right? And there is one more thing which is again very commonly used in wounds which are clean, very straight, clean wounds. and especially for the patients who are very scared of suturing. So we can make use of these sturdy strips, which are very commonly available. Again, so what you have to do is basically in clean, small clean wounds and straight wounds, what you can do is you can clean those wounds nicely. And what you can do is you can dry those wounds and you can directly apply these tapes for approximation, right? So you just apply it on one side of the incision or one side of the wound, and then you kind of slightly pull it and you stick it on the other side. So that is how the wound edges are approximated. Okay, easy. No suturing is required, right? Coming to the complications, I will have to brush through these. So infection is one complication that can happen if one particular area is sutured. So poor technique can leave gaps, especially if you don't suture it nicely. The chances of infection will increase because the inside of the wound is exposed to the outside environment, right? And if non-sterile sutures are used, so always and always the suture material that is used should be sterile. If you're using packaged suture, then obviously 100% it will be in a sterilized form. But if you're not using a packaged one, make sure that you use the sterilized the sutures and use. They should be autoclaved. Okay. Dehiscence is another problem that is very commonly associated with suturing if it is not performed nicely. So reopening of the previously closed wound. So that can happen if you have sutured, if the sutures are very loose, or it can happen if they are very tight, extremely tight, which has caused them to blanch, which have caused the tissues to blanch and to undergo necrosis over a period of time. Or if they are not placed correctly, they will just open up. Scarring or keloid formation. So if the suture is supposedly inappropriate tension or inappropriate technique is used, there can be a lot of scarring. So right suture should be used, right suture material should be used, right suture diameter should be used, and also right suturing technique is important to avoid the scarring or keloid formation. Necrosis, I already mentioned it in the beginning. If you perform excessive tight suturing, then what will happen? There will be compromised blood supply at the end of the wound edges, and there will be necrosis of those edges, which will cause that tissue. And again, that will obviously then lead to dehiscence and gaping of the wound, which can also lead to infection later, right? So one complication of suture can actually lead to some other complication also, right? Tissue granuloma is also common, especially the patients who are kind of allergic to some kind of suture material, right? So another thing, allergic reaction, very, very common, especially with the naturally available sutures. They are common in certain patients. Especially for the naturally derived sutures, synthetic sutures, in synthetic sutures, allergic reactions are not very common. Okay. Delayed healing. So if the wound edges are some misaligned or if there is some interrupted blood supply or something when you're suturing, then there can be compromised healing. Okay. Foreign body reaction, because after all, it is a foreign body, right? So it can undergo some foreign body reaction also. Some chronic infection can happen, right, with certain sutures in certain patients. Okay, so here I would like to end my session by expressing heartfelt gratitude for listening to me patiently at this time of the day. And I would say that I would end my session by saying that suturing is a technique where precision meets healing, right? So more precise you are, better healing you will offer, correct? So it is very, very important that whatever theoretical knowledge I've given you all use it for selecting proper suture material, and you really practice a lot of suturing so that you end up doing good suturing and offer great healing to your patients. Okay. So, doctor, I'm done with my session.
Yes, doc. There are some doubts by few participants. I'll just read them out.
Yes.
Okay. So, ma'am, if the removal techniques for all types of sutures and which suture is used where? I think this is a very prior doubt. So I think you have already solved it.
Yeah, I've kind of solved it.
Yeah.
Yes.
So there is a doubt by Dr. Khan. The first knot that is given while suturing is called secure or surgical knot.
Sorry, can you repeat it?
The first knot that is given while suturing is called secure or surgical knot.
The first one is always a surgical knot, and the second one is secure or safety knot. Okay, which is given in the where the flow is going to be anti-clockwise. The first will be 2 clockwise turns, and The secure suture will be given secondary, in which the throw will be anti-clockwise. Okay, to secure it in place. As the name suggests, it is going to be second knot to secure the suture.
Okay, and okay. Where is proline used in dental procedures?
In dental procedures, see, very commonly proline is not used, although we can make use of proline for intraoral, flap closures and all. We used to make use of proline sutures in alveolar bone grafting cases, in which it was not used intraorally, proline sutures. They were used from where the graft was taken for alveolar bone grafting, that is from the hip areas. For alveolar bone grafting, I don't know if you're aware of this term, where the alveolar bone, there is some deficit of the alveolar bone. So what we used to do, we used to take a graft from some other place and we used to graft it, especially from the hip area, and that we used to graft intraorally. So that area, the donor side, we used to close with the proline suture. So not very commonly this proline suture is used intraorally, although it can be used, it is in fact used extraorally for skin suturing and all. Okay, but it can be used for intraoral purposes. It's not like it is contraindicated or something. But when we have a better options available, we usually don't go with proline suturing intraoral.
Okay, so next out is which circle like 3/8 is ideal to use for extracted socket?
Which kind of a circle you're saying, which can be used?
Yes, ma'am. Ideal to use for extracted socket.
I would say academically, half needle is very commonly used. Although we can make use of 3/8 kind of a needle also, because in extraction sockets and all, it is superficial, right? So we are not dealing with any deeper flaps or something. Unless you're dealing with deeper flaps, or wherever you are dealing with superficial tissues, just take this generalized thing. We will make use of 3/8 kind of a suture because it is a very shallow needle, right? Shallow needle. So we'll use for superficial cases. So you can definitely use it for extraction sockets and all, but very commonly used for extraction sockets are half needle, half needle.
Okay. Then Vicryl and silk is less commonly used in dental procedures. Why?
Vicryl and silk is less commonly used. I would say it is very commonly used in dental procedures, intraoral. It is very commonly used, I would say. Because we have performed all the intraoral suturings in our casualties with Vicryl sutures, and in your, in academics, in colleges and all, the most commonly used suture is in fact silk for intraoral cases. For your extraction socket closure and all, very commonly silk is used. And even Vicryl.
Then an ideal diameter and length for a suture.
Dear friends, it all depends on what kind of tissue you're dealing with. It is a very vague this thing question, because you have to decide that based on what kind of tissue is available. So that is the exact that was the exact purpose of this presentation. So what is the suture length? I will use a longer suture length, the 90 centimeter maybe suture length. The suture lengths also, different types of suture lengths are available: 45 centimeters, 70 centimeters, 90 centimeter. So I would obviously go with a bigger thread where I have to use probably a continuous suture and a longer laceration or a longer incision that is taken, right? But for a shorter one, I would not want to waste that suture thread, and I will use a smaller thing, maybe a 45 centimeter kind of a suture, or maybe even smaller. Okay. So that is the thing. So that it depends on the tissue. There are the decision making is multifactorial.
Okay, there is one more doubt. The suture should be tweezed out buccally or lingually palatally, given the debris is always there buccally on the knot.
I'm not able to understand this question. It should be pulled buccally or lingually, you're asking me.
Yeah, buccally or lingually, given the debris is always there buccally on the knot.
No, it is not like that. See, whenever you're taking, supposing if we are talking about an extraction socket, correct? So we always go from buccal to the lingual end, right? We always catch hold of a buccal flap, and then we go from the buccal, then from inside of lingual flap, you go to the lingual side, and then you tie the knot on the buccal side. So I'm not able to understand. So obviously, when you're trying to pull the suture, it is always going to be from the buccal to the lingual end, right? So I hope I've answered it.
Yeah, and
I didn't understand what is that debris part of it, because It is always like you never go from the lingual to the buccal tissue. You always go from the buccal to the lingual tissue, and then you pull the suture and then you tie a knot on the buccal side. Correct?
Okay, so now there is some genuine concern. I think the doctor has a doubt that how
Okay.
to put the knot that to avoid food will not stuck in between the sutures.
So, how to put a knot so that it doesn't stick in between the sutures?
The food will not stick into the between the sutures.
Acha. Okay, so see, inevitably, I would say for a knot to be tied, it should always be present on the buccal side. Never it should be present on the lingual aspect. Now, the next question is the concern is ki, how the debris won't be accumulated. So that won't be accumulated if the patient keeps the oral hygiene good. Otherwise, there is always going to be some debris. If you have multiple knots involved, the debris accumulation is going to be more. That is usually you have to do in monofilament sutures and all, where you have to tie multiple knots, then the debris accumulation becomes a little problematic thing. On the other hand, when you talk about multifilament sutures, where the minimal knots have to be put, then the debris collection is going to be less. Having said that, you should always tell the patients to maintain oral hygiene when the suture is present in situ, because otherwise the debris accumulation is going to be there. Okay, so there should be like a lot of cleaning and all that should be performed, rinsing and all, so that the food debris accumulation over the knots is not there. Okay.
There is a last doubt now.
Yeah.
The suture staple last how much days is it needed to cut or absorb like vicryl?
How many days are needed for a vicryl to get
To
absorbed?
cut, yeah, to cut or absorb. The suture staple last how much days
Suture
is it
staple.
needed to, yeah,
Acha,
STRAPLE, yeah.
the staple sutures. This is what you're talking about. The mechanical wound closing devices. This.
Yeah, I think so. It is the same thing.
Okay, so now these particular surgical staples, they don't resorb on their own. As you can see, they are not made up of resorbable material, right? They are made up of kind of steel material or something. So they never resorb on their own. And basically, these type of skin staples and all, we used to in oral and maxillofacial surgery very commonly used for neck dissection cases, where you have very huge wounds, or even in cases where a PMMC flap used to be raised, right? So in those cases where you have very, very huge wounds present, it is very difficult to perform suturing. So we make use of these surgical staples, and there is a device available to remove these surgical staples. Okay, so it all depends on. So what we do when we remove these surgical staples, we remove alternate staples. I'm sorry, with that particular device that is available. There is one beautiful device where you have to just insert it between the staple and you just have to press it, and then it just opens up from both the sides. So that instrument is used to remove the staples. And another thing, what we do is we remove alternate staples. We check if the healing has happened or no, and then we remove the remaining staples. So it all depends on what kind of tissue and what area this suturing is. These staples have been used. It is also very commonly used in orthopedic surgeries, right? So it again depends. Like it can be like around 2 weeks, it can be 3 weeks. It all depends on how much healing that has happened. So it is completely the surgeon's call when they need to be removed, and you never remove all of them together. It is always alternately they remove, and when the healing is complete, then you remove all of them. Okay.
Okay.
Yeah. Anything else?
Okay, so thank you so much, ma'am, for such an insightful session. I think all the participants have loved it. And thank you for taking out your time and your efforts. Thanks a lot. Thank you, ma'am.
Thank you so much.
And
Thank you so much. Uh, thank you all for listening to me patiently, and thank you for guiding the session so well.
yeah, and for all the participants, I have shared the participation certificate link in the chat box. Please do fill in the form to receive the certificate. I'll be waiting for last 5 minutes for everyone to fill in the form. Okay, thank you so much, ma'am. Good night, ma'am. Good night. Thank you, ma'am.
Thank you, doctor. Thank you very much. Can I log off?
Yes, ma'am.
Okay. Thank you
Yeah.
so much.
Thank you, ma'am. For all the participants, this is the last chance for you to fill in the certificate link which has been shared in your chat box. I request everyone to kindly fill in the form. Okay, thank you everyone for your time. Good night, everyone. Bye bye. See you for the next webinar.